Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is employer best practices for working with health insurance brokers and benefit consultants. So, believe it or not, there's a lot of contracts between employers and their broker benefit consultant that you can find online because a lot of public entities are required to make public their contracts with their vendors. So you can use AI, or you can just go on to Google and you can actually look at these contracts. And when you see these contracts, you find something very interesting. So I found one particular example, and I found other examples that are very similar, where this employer with 9,000 employees, their contract with their broker consultant to manage their employee benefits plan was they paid them $175,000 a year in 12 monthly installments. Okay? Now, I'm like, and they listed out all the things that the broker consultant needs to do for this $175,000. And it's a lot. I'm like, okay, so maybe that's like, that's a good paying job full time for one person. Let's say the broker consultant had like a full-time person dedicated to this employer with 9,000 people. Shoot, there's no way that one person making $175,000 could do all the things necessary. So I'm like, there's got to be money coming from somewhere else. And it's like, of course, because the broker consultant is making commission from the insurance carrier and the PBM and the dental and vision and all the other short-term disability, long-term disability, worksite products, etc. All the other groups that work at. So a lot of broker consultants, they'll structure those commissions, and oftentimes they'll kind of wrap up into like about a $15 per employee per month payment in terms of like all the commissions that they're getting if you pooled them from all the different sources. Now that's an approximation, right? So if you take the $15 per employee per month times the 9,000 employees times 12, what do you get? $1.62 million. Okay, that's almost 10 times what the actual employer themselves are paying the broker consultant. So then the question becomes, okay, who in the world is the broker consultant working for? Are they working for the organization that's paying them $175,000? Or are they working for the people that are paying them $1.62 million? Well, of course they're working for the people that are paying them $1.62 million. In fact, there's this old expression that says, whose bread I eat, his song I sing. In other words, bread in this case is money, and song is singing songs of praises. In other words, who's given me bread to eat, I'm going to sing their praises. In other words, you're going to be loyal to who pays you. Now, that explains why, of course, the broker consultant is loyal to the carrier, etc., because they're paying them gobs more than the employer. Okay. Keep in mind, this expression, this saying, is from Europe in the 1100s, okay? So you gotta pay attention to sayings that I know about 900 years later, right? The fact that I even brought this up 900 years later means that maybe there's some truth to that comment. Okay, so fine. So what this gets us down to ultimately is the principal agent problem, where you have a principal and then you have an agent who's acting on behalf of the principal. And the problem is when the agent does not act on behalf of the principal. And the agent will not act on the behalf of the principal typically for two reasons. Because one, they have different incentives, and two, they have much greater information. And so what you have with an employer and their broker consultant is the perfect example of the principal agent problem. But it actually even starts within the organization itself, where really the principal is the actual organization. It's the CEO, it's the shareholders, it's the actual employees and their health benefits plan itself, right? So you've got the organization, and then the agent who's acting on behalf of the organization is really specifically the HR department. It's specifically the benefits department because they've been tasked with running the employee benefits plan. Okay, then you have another principal agent issue where you've got, in this case, HR, who was the agent, becomes the principal, and their agent who's working on their behalf is the broker consultant. And then the broker consultant also is its own principal with its own agent. So the broker consultant itself is a principal that has an agent, which is the insurance carrier. So it's referred to as nested principal agent problems, right? So you have the organization to HR to broker consultant to the carrier. So you have a whole slew of principal agent misaligned incentives and informational asymmetry. Let's go through some examples of that. So let's talk about the incentives first. Okay, so the organization, so there was actually this poll that said, what are the major concerns of employers? Not the HR people, but the actual employers themselves. The number one issue was cost. And then talking with HR professionals, they have to deal with the employee noise, and these HR departments are notoriously understaffed, and so they just need to do things that are easy because they don't have I've never talked to an HR department that's like, oh, we've got so much bandwidth. No, typically they're looked at as a cost center, so they're hugely thinly staffed, and so they just need to do stuff that's super easy to do because they just don't have the capacity to do anything with any degree of complexity. Again, it's not their fault. They're hugely understaffed. Okay, then next you've got the broker consultant, and of course they're always trying to maximize revenue while minimizing the amount of time they have to spend with a client, because obviously you can have more clients the less time you spend with each one. So you're trying to make that client feel like you're spending a lot of time with them, but spend as little time with them as humanly possible, yet still maximizing the revenue. And yet at the same time, you've got the carrier that's trying to maximize their revenue. And interestingly, if you listen to the carrier earnings calls, they make a lot more revenue off of the RX payments from the pharmaceutical companies. They call them rebates, but it's really commissions by the pharmaceutical companies to the PBMs that the carrier, that's a huge revenue driver for the carrier. Okay, maybe the stop loss premiums a little bit, but a lot of the money's in the meds. Okay, now let's go through the informational asymmetries. Okay, well, what does the overall organization know? What does the CEO and the board of directors, if you have unions representing the employees, what do they know about healthcare? In the vast majority of the case, like nothing. Like, I'm not trying to be too harsh here, but the vast majority of employers, like I said, I talked to these CEOs, and like I told you last week, the CEO's like, I should not be expected to understand healthcare. Like they're not even trying. Okay, again, I'm not blaming them. I'm just telling you that's the reality of the situation. Okay, next up, HR has very little understanding of healthcare. Okay. And listen, and I'll tell you, part of that is because the majority of HR people that deal with benefits, they've been pulled from other parts of the organization. Like, they have no history, no track record, no experience working in healthcare or benefits the vast majority of the time. Sometimes they're finance people, sometimes they're compensation people. Shoot, the head of benefits for this huge airline, they came over from recruiting. Listen, God bless her, she was trying her best, but that was her experience. It was in recruiting. It wasn't in the healthcare system of the United States. Okay. And then broker consultants, they got some understanding of healthcare, but I'll tell you, at Compass, when we first came out and said, look, the in-network allowed amounts are different among different in-network hospitals. So you could have an MRI at one place that's $1,500 and another place that's $500, both within network at the same carrier. And the vast majority of broker consultants told me that was not true. Well, that was exactly true. So they totally did not understand the basics of the contracting that their carriers were, the carrier products that they were selling. They had a complete lack of understanding. Again, it's not their fault. They didn't know because the carriers didn't tell them. Okay, now what do the carriers know about healthcare? Carriers know a lot about healthcare. Okay, so here you have huge informational asymmetry, where you want to talk about expertise in how the inner workings of healthcare finance work. Believe me, the carriers know everything that I say on A Healthcare Z. The carriers know everything I already say. Okay, and then so you have huge decreasing information when you go this way in the nested principal agent problem. Okay, so fine. Dr. Bricker, don't just give me problems, give me solutions. Okay, here are real world solutions that I have seen employers make in regards to the principal agent problem. Okay, first, we're gonna break it up into the incentive solution and the information solution. Okay, so for the incentive solution, high performing organizations, when it comes to employee benefits, the relationship between the organization and HR is such that HR's bonus is based on their total health plan budget, including fixed cost and variable cost. So fixed cost for all of their premiums for stop loss, for their consulting fees. Okay, so it's fixed fees, and it is also the variable cost of the claims. So it's not just based upon claims performance, it's the combination of the two. Okay, and that bonus can be upwards of 20% of total HR comp. And so you want to align HR's financial performance in terms of controlling costs with their own bonus. Are all of you bonusing your HR departments 20% based upon health plan performance? If not, just know that's a best practice. Okay, next up, between the HR and the broker. Okay, so here if the broker's getting paid so much more by the carrier than by you, the employer, how in the world are you going to align the broker's incentives with yours, the HR department? Well, shoot, you're going to put them out to bid every 3 years, because if they don't perform, they're out. So you have to hold their feet to the fire. Like, there's no way you're going to get them to spend more time with you and not try to maximize their revenue for them, at your loss. There's no way you're going to be able to hold their feet to the fire unless you're like, look, you're going to be RFP'd every 3 years based upon your performance. And yes, like, I don't think that employers are going to start paying more than $175,000 to a broker consultant for 9,000 employees. Like, I don't think that's going to change. But you're essentially, the broker is bidding for the opportunity to earn this $1.6 million in commissions. And so you're like, fine. Like, we're going to put you out to bid every 3 years, and if you can't perform, then you no longer get the right to earn that commission. You're gone. Okay, so you got. The good news is there's tons of competition for brokers. You as an employer, if you put out an RFP for a brokerage, then you absolutely have tons of choices. Okay, but like Thomas Edison said, most opportunity is dressed in overalls and looks like hard work. So you're going to have to do the work. Okay, and again, HR departments are strapped. Blah blah blah. Like, I get it. It's not an easy solution, but again, it's the best practice. Like, believe me, I've met with lots of employers where it's like, yeah, we totally RFP our broker every 3 years. There's no way that we're gonna be able to just, based upon, because the broker oftentimes are incredible relationship builders. But you have to have an objective view of the broker's performance for the sake of the organization and the employees, right? I think any rational person would understand that. Okay, next up. Then the broker and the carrier. Again, you've got a principal agent problem there. Again, the broker is essentially an outsourced purchasing department for the employer, right? If you look at the broker contracts with the employer, the broker is essentially contracting as the purchasing department. Okay, well, fine. Then if that's the case, then the purchasing department needs to do their job, and that is they need to RFP their carrier every 3 years. Be like, look, you the carrier, you need to perform, but we're not going to keep. I mean, shoot, carriers are with the same group and the same broker for 3, 6, 9, 12. We've been with XYZ carrier for 15 years. Holy smokes, that's a problem. If your company has been with the same carrier for 15 years, like, something's wrong there, okay? Have you really RFP'd them every 3 years? They've won 5 RFPs in a row. And if so, when you RFP them and you keep them, then you can even get better terms because you're inducing competition. You have to have competition. If you don't have competition, you're hosed, right? Capitalism without competition, by definition, is exploitation. So just know, if you're not taking advantage of competition, you're going to get exploited. Okay, fine. So then the informational asymmetry solution is I've seen organizations where the organization and HR, because basically they need to learn more. And what they've done is they essentially have formed a benefits committee that involves not only employee leadership, sometimes it's the union, but then also people from finance and people from HR, other parts of the organization. And they actually have a committee that will meet monthly or quarterly, and they'll actually use a lot of that committee time to mutually educate themselves around the issues of the health plan, around the issues of PBM transparency, around the issues of high-cost claimants, around the issues of GLP-1s. So if you collectively educate all the interested party within the organization and do that with a committee structure. Sometimes it's just the CEO that's taken it on themselves, but in much larger organizations, I've seen it be done through a committee. Okay, next up, in terms of the HR and the broker, okay, well, if the broker is essentially the outsourced purchasing department, then as a best practice, what I've seen is that the HR people themselves become expert purchasers. They go to like purchaser conferences. They talk to people. There are purchasing professionals out there, right? Believe me, the purchasing departments of America would love to be involved with HR because the vast majority of purchasing departments in America are not involved with HR. And so to the extent that you have a purchasing department within your own company and you can learn from them, or you can go to purchasing department conferences, there are best practices within purchasing that a lot of the times HR folks aren't familiar with. So you got to educate yourself around these purchasing things. And a lot of it has to do with like contractual details. And guess what? The devil's in the details. So you better know those contractual details. Okay, next up, between the broker and the carrier. Okay, so here, what the carrier really is, it's like Visa or MasterCard. They're just the organization that facilitates the provider of payment, right? I mean, all this is done to get the patients to the doc and the patients to the hospital and the patients to the lab or the imaging center. So all these steps in between, including the carrier, are just to get to the actual provision of care. And so the broker, you actually have to understand, like that whole like price transparency thing that I just explained a minute ago, like you as the broker, you need to understand how the carriers pay the docs and the hospitals, how they pay the providers. Because otherwise the carrier will tell you something, you don't know if it's true or not, right? So how do you do that? Well, actually a good way to do that is there's actually a financial association for provider organizations themselves. In other words, the people sitting on the other side of the contracting table from the insurance company, the CFOs of the hospital systems and the CFOs of the physician practices, they're part of a professional organization called the HFMA, the Hospital Financial Management Association. And they have state chapters and they have state meetings and they have national meetings. So you as a broker, you could totally go and become involved in these HFMA at the state level or the national level, and you would learn a ton about how carriers pay providers, and you'd be learning it from the providers so that you got both sides of the story, right? Because you hear the carrier side of the story all the time, but now you could hear the provider side of the story as well. Okay, so that's how another way that you could address informational asymmetry. Now, last but not least, if you really wanted to level up, in other words, if you're like, okay, I did this, but now I want to go the next level, here's what I've seen the truly top level performers do. To level up, you go the next level down in the organization. In other words, if you're the organization, instead of just going to HR, you actually go to the broker. And you have to establish yourself as an organization in the expertise of the broker. So in other words, you, the organization, are actually experts in purchasing, right? Because that's what the broker's expert in. And then if you're HR, you go one level beyond the broker to the actual carrier, and you in HR become an expert in provider payment. And then you as a broker, you go one level beyond the carrier, and you as a broker become an expert in care provision. Because that's what the carrier is ultimately paying for, is care provision. So just know that you might be operating at sort of a 1 out of 10 level in terms of best practices with interacting with your broker benefits consultant, but you can get to level 2, you can get to a 5, you can get to a 7, you can get to a 10. So Rome's not built in a day, but there's absolutely a structured path of best practices for employers to improve how they work with insurance brokers and benefits consultants. And that's what I wanted to share with you today. Thank you for watching A Healthcare Z.